paycheck, wondered who FICA was getting some of my money. And I started paying attention to what was going on with taxes, the role of government. And I went out to Washington, D.C., and I banged on Chuck Grassley's door. And for the past 7 years, it has been an honor to work for you, being entrusted by him to run his office, working for Iowans. So I've seen the dysfunction up close. I know what works, what doesn't work. I know what can be done and how to get it done. And when you're working in an office with Iowans and for the senator, and you're on the phone with Iowans every day, on the phone with farmers, hearing about the problems with the EPA, or in meetings with families or businesses, business leaders, small business folks, talking about how the IRS is coming down on them, you want to work that much harder and you find ways to penetrate the government. Now that American dream is still there, and I'm optimistic, but there are 3 deficits that are in the way that we have to tackle. The budget deficit, the jobs deficit, the trust deficit. $17 trillion. It's $17.4 trillion right now. It's abysmal. You know, we can blame Obama all we want, but at times, some of our Republican presidents and Congresses have spent too much money. And I will be a taxpayer watchdog for you. I will. I've got some literature here that lines out some of my budget principles. Auditing the government, sunsetting legislation, changing the way we budget from just giving agencies and departments everything they want every year without accountability. We need accountability with this government, and I know how to do it. We need a balanced budget amendment. Families, businesses, this state, 49 states, they have to balance their budget. Washington should too. The jobs deficit, Obamacare, is crushing this economy. It's crushing this economy. And it's hurting the relationships between doctors and patients, employers, employees. I'd love to repeal that. I want to repeal it. It's going to be tough as long as we have this president in there. He's not going to let his key signature legislation go. But I'll push for repeal, but we also have to have solutions. Tort reform, dropping the boundaries across state lines, price transparency, expanding health savings accounts. We have to be a party of ideas. We can't just be a party of no. And you really want to get at the jobs issue? This tax code, 74,000 pages. If you're having trouble sleeping at night, just whip that out. End of page 1, you'll be snoring. But we need to simplify the tax code. And it needs to be made certain and permanent, so businesses and families can play in the economy and invest and create jobs. We need to pass the Keystone Pipeline. It's a no-brainer. It's not even taxpayer funded. And the trust deficit, we have a president who says that these are not scandals, that they're phony. Well, you know that Fast and Furious is not a phony scandal. Our border agent Brian Terry died as a result of our government selling guns to drug lords in Mexico. That is not phony. Benghazi's not phony. And we have someone running for president now who was Secretary of State at the time who threw up her arms and said, what difference does it make? Well, you know it makes all the difference in the world, folks, for the sake of truth, accountability, and so it will never happen again. You know, I learned from Senator Grassley the art of oversight and investigating. I'll be one vote in Congress, but I can do more. I can watch this government. They're watching us, someone needs to watch them. I was there under the Fast and Furious scandal investigations, IRS investigations. I know how to watch this government, and I'll do it. I'm asking for your vote.
Thank you. Now we'll go to the questioning phase of the forum, and the first speaker will be Secretary of State Schultz, and the question is this: the most discussed and maybe cussed issues is the Affordable Care Act. If elected, what is your stance? Repeal, replace, leave alone, and keep tweaking? Please detail your answer with concrete specifics. And we have, each member has 3 to 3.5 minutes.
Okay, very good. Repeal. Have to repeal it. It's terrible. It's a terrible piece of legislation that has to be repealed, and we have to replace it with a free market system. A system that allows people to purchase their insurance across state lines, allows small businesses to group together just like large organizations or corporations to be able to get those savings. But we have to go further than that. If we want to support the free market system, we need transparency. A lot of healthcare experts I talk to say that of the $3 trillion we spend in delivering healthcare services, a trillion of it is waste. And think about it. We don't really know what we're paying for as consumers. We pay our premiums, we pay our deductibles, our co-pays. But when's the last time you got an itemized bill from the hospital that tells you everything that it costs? They just give you a bill and you pay it. If we want to have a system that's efficient, cut the waste, we have to have transparency. We have to have tort reform. We have, again, Bruce Braley doesn't like tort reform, but we need tort reform if we're going to have doctors quit practicing defensive medicine, which, again, drives the costs up. And when we're talking about costs, we also have to talk about wellness. We need to have wellness programs so that people are focusing on their health so they don't need to get healthcare services except when it's absolutely necessary. This is the kind of principles that we need when we're replacing Obamacare. We can't throw the baby out with the bathwater the way Obama did, where he threw our free market system essentially out. Because what they're trying to do is get to a single-payer system. That's what they're trying to do. This has just been an utter failure, and I'm sure they're hoping that the people will just want the government to come and fix it for them. That's not how we fix things in America. We fix things through a free market, through freedom. And that's what we need, a system that promotes freedom. And that's what I do if you elect me to Congress. I would repeal Obamacare, and I'd put a free market system in place. Thank you.
Next speaker, Monty.
All right, well, I don't think you're going to hear a lot of disagreement from the folks sitting up here on Obamacare, as I like to call it when I tweet about it. I call it hashtag Obama doesn't care. It's exactly the wrong type of public policy. It does take away personal choice and replaces government decisions. It raised taxes, all kinds of taxes that don't make any sense. And in doing so, it burdens the economy to the extent that the CBO says it's going to add $1 trillion to our national debt. Not even from the new spending part of it. That's just from the part of it that slows the economy down because our businesses don't have a clue how this is going to impact them, so they're not willing to go into that uncertain world and invest in new equipment, new plant, heaven forbid, hire that new employee, and reduce our unemployment and get someone on a job working and paying taxes. And so it's just going to crush this economy. It is the poster child for what's wrong in Washington, D.C. So I agree, tort reform. We need to allow more competition amongst plans, not less competition. You know, we went from not being able to buy health care over state lines to, if you're in one of the Obama plans, now this doesn't apply to the private insurance, but if you get forced into one of these Obama plans, you can't even buy insurance over county lines anymore. You have to use an approved plan in your county. And guess what? In counties like Guthrie County, they just did a report, and you typically have one provider, one authorized provider, and it's more expensive than in the bigger cities where you might have 2 or 3, and therefore a tiny bit of competition. So we need to do that, and then I'm a big advocate for price transparency and putting, but what's that mean? What's that mean? It means putting the decision-making power back in your hands. So because we all kind of agree on the issues, let me tell you how I think of that. I think of that like this. When I go to get my oil change, yes, I used to do it, now I'm kind of lazy and I don't. And you go into the place, they say, okay, you get your oil change, there's going to be lube and filter, we're doing our 87,000 point inspection, here's the amount signed, this is what you're going to pay. And then goes your car. Shouldn't we do the same thing for our health insurance? If you're going to have a major heart procedure, you just go in, you get it done, and several months later, you do actually get a pretty itemized bill, because I've seen them and they're about this thick. It wasn't for my heart like this. You'll go paying where you go. Shouldn't we shop around and make sure that we're getting the highest quality? I'm not saying you just go with the bargain basement price, but the highest quality at an affordable price and put competition into the system. That's what keeps the price down and the quality up in every other product in the world, and it will be the same for healthcare.
I have a couple personal experiences about health reform. I have a cousin, Dr. Michael Fulgi, my dad's sister's son. He's one of the 5 doctors at Broadlands Hospital. ever since Obamacare has come into effect, they have been overwhelmed with people. Overwhelmed. People lost their health care. They have no place to go. They have no place to go. And the horror stories that my cousin has told me with the people that have gone into Providence Hospital, which is for people that did not have insurance, it has just gone off the wall. All the things up here that these other gentlemen just, of course, repeat. Defunded, start all over. My other experience is with Governor Tommy Thompson. I was the Polk County Chair, and I could probably say verbatim what he said. He was the head of Health and Human Services under President Bush. And of course, our healthcare system needed to be tweaked, it needed to be improved. He wanted to be able to go from state to state, and this has been set up here. But he said your records should all be on one little disc. When you go into the hospital or your doctor's office, there it is. There it is. And the doctor that you go to knows your past history. So there's no mistakes. And you can look at it and make sure that it's all up to date. Governor Thompson was emphatic about making sure that you knew the price. And so you can see what it costs. So you bring in competition. And not too long ago, I had a colonoscopy, and I always ask the doctor, what do you think about this Obamacare? He said, Joe, it's awful. He said, they should know what it's going to cost. And if I don't charge as much, and other people charge a lot, and I'm a good doctor, they're going to come to me. Because I'm a qualified doctor, and I'm better than the other person. And I work hard. So those 2 life experiences myself will put me in position to be the next congressman.
Thank you. Well, not everyone has said it, but we're all saying the same thing, so I'll just try to. Price transparency, of course, is something that we need, and I'm glad other people are talking about this. I've been banging on this for about 7 months. But one reason why we need to know what we're paying for is because a lot of the times, the taxpayers are paying for this through Medicare. And so taxpayers deserve a right to know what they're paying for. Yes, I want to repeal Obamacare. I want to more than anything. And we have to have solutions. Defensive medicine. Doctors and hospitals, they're practicing every kind of test out there and procedure for fear if they don't, whether they need to do that test or not in their own mind, they fear that they're going to get sued. And that, of course, drives up the cost of health care. We need to try to find a way where we can make health care portable, where you own it. Some people feel really tied down to their employer because of health care. If we can make a portable system where we can carry it around with us from job to job, that would be a lot better. Site neutrality. A hospital will charge one thing for a procedure, and a doctor will charge another thing. Maybe they're 8 blocks away. They should be charging the same thing, especially when they're charging the taxpayer. And you know what really gets me about this law? What really undermines our country on this is the rule of law. And President Obama changing the law as he sees fit. This is the law. If he doesn't like this law, my goodness, there are members in Congress who will help him change it. And will send a bill to help him delay the employer mandate or push back the individual mandate. The law has been changed about 25 times. So we need some strict oversight on this president with this law. I would demand that whatever change that he makes that's outside the law, his Department of Justice, his Health and Human Services Department, they have to justify it. And my goodness, with all the new rules and regs coming out, about 1,000 more, who knows what's coming? We have to have strict oversight. I know how to do the oversight, folks, and watch this government. And we've got to keep the IRS out of our health care. There is no need for the IRS to get involved with this. They bundle everything up. They're intimidating. They'll try to dictate our lives through the IRS. We cannot have that. Repeal, replace, fix it with free market principles with strong oversight. Thanks.
Thank you very much. Great question. Simple answer, repeal it. I'm the only one that's sitting up here that voted against the expansion of Obamacare in the State House. And that was the Medicaid expansion, which is exactly what it is. There was 150,000 people that were added to the Medicaid rolls in the state of Iowa. We're probably all going to agree about what we need to do. This plan is disastrous. With the goal of signing up 40 million people by Monday, where there's 7 million people that signed up. And why is it disastrous? I just talked to someone not too long ago that's about 30 years old, female, in good health. We were lied to. She was communicated that she cannot keep her health care plan, and that her plan, going on the website, is going to go up $300 per month. I don't understand why the people of Washington, D.C. cannot do research and take a lesson from history. Because you could just go far north to Canada, or you could go into Europe and see what's going on when the government takes over your healthcare system. And I'll give you an example of my father who went on a fishing trip up to Canada, and one of his buddies had heart problems and had heart pain, and he went into the local hospital, and he could not see a cardiologist for 3 days. Luckily for them, they had the resources. They got him on a plane, and they got him into Minnesota, and found out that he had a full-blown heart attack. We cannot allow the IRS to get into our business. I will tell you, it is one of the most important issues that we have to deal with. It is estimated to cost $170 billion in expenses to us taxpayers for a broken system. How do we solve this problem? Yes, repeal it. We have to break it off in pieces. I've been in the State House. I have co-sponsored legislation for tort reform. I've been at the State House, and I've sponsored legislation to buy across state lines. I agree with everything that's said about transparency and most importantly, tort reform. And I've got a very good friend that has a healthy young son, and he has a health savings account with a catastrophe health insurance policy. And he went in because there was like a heart murmur that was going on with his son. And he said to the doctor, listen, I'm paying cash for this. And the doctor said, well, if that's the case, if you'll sign on the dotted line here, we can eliminate 6 tests. And that's what's going on in our healthcare system. Thank you very much.
Next question. The Affordable Care Act dictates that a full-time employee gains that status at 30 hours per week. Next week, H.R. 2575 will be voted on in the House of Representatives and trying to return the 40-hour as the standard. How would you vote on that issue, and how do you think it affects Iowa businesses as it stands today?
Well, I've not had a chance to look at that specific piece of legislation, so I'm not going to talk about the specific piece of legislation, but I will answer the question about the 30-hour week. You know, what they did is they tried to lower down what counts as a full-time employee so that more people would be covered under this. And then, of course, business responds, the marketplace responds, and they said, okay, now instead of being, you know, you have a kid in high school or something, or in college trying to make some money, now they can't work that 31st hour because then they'd be a full-time employee. So I've even heard in D.C., well, hey, let's just lower it down to 25 hours then. Everybody's working 29 hours a week. Well, business would just respond as silly. This is the silliness that you get into when you try to micromanage these things from the government level, instead of letting